On this episode of Africa Health Check,
if the youth are being involved, I think we'll have a better Nigeria because they will move the country forward.
Involving them in district council meetings that are about health or any activity that involves talking about health.
we explore the reasons why youth engagement is crucial in addressing healthcare issues in Africa.
So us coming up with our own solutions, our own voices, is just stating that we're potential enough as youth.
And highlight some impactful youth stories. Africa is a youthful continent with nearly 3/4 of the continent's population being young people. There's an African proverb that says, "You cannot shave someone's head in their absence." Yet, many stakeholders continue to do programming and implementation without meaningfully engaging the majority of the population. On today's episode, we will be discussing engaging young people as health advocates. I am your host, and I welcome you to Africa Health Check. I'm joined by our experts, Dr. Marianne Morethi, the chair of the Department of Medical Microbiology and Immunology and a senior research fellow at the University of Nairobi in Kenya, as well as Reverend Anthony Achempong, who's a pharmacist and a pastor from Ghana. Before we hear from our panelists, let us have a look at this episode's feature story.
My name is Vivian J. Joseph, and I'm the head of the health cluster from the Southern African Youth Forum, SADC, and I come from Dar es Salaam, Tanzania. What motivated me, it comes from being as a young girl. And back in the days when I was a child, I was really much passionate in helping people, and more especially on making them feel better. So as I grew up, I found a link to it in improving people's health could be a matter that would make me feel better, because I will make people also feel better. Building a network of health advocates whereby we're also going to have a one-on-one interaction, or maybe through Twitter spaces, coming up with a topic and giving each other knowledge on how to go about it, but also having giving them opportunities to represent their fellow youth and sharing their voices is partly of equipping them with confidence, and such is adding up to skills that are going to help them become better health advocates. I participated in being trained to become a COVID-19 champion, but I also took that opportunity to start a community-based education through a field work in a village called Lugoba back home in Tanzania, the coastal region, whereby I used that opportunity to educate door to door in the villages, to let them know what COVID-19 is, and more especially to emphasize on the importance of vaccination, because at that time it was really hard for people to actually get the knowledge of, is this vaccine gonna work? Is it going to cause any harm to us? So now, and it's true, community-based education has really been effective. And from then, a lot of, majority of the villages agreed to being vaccinated, and we all escorted them to clinics and to the small health facilities for the vaccination. And I would say that is one of the successful stories I have on community-based education. Well, now that we have the advancement of technology, it's really easy to reach out to so many youth, 1,000 of youth, and more especially that I work for a regional body. Through social media could be one of the most powerful tools I use in terms of data collection from the youth and putting them in the researches. I also lead SADC Rare Disease Coalition, and part of it, we have surveys that we share out and to hear the youth voices in terms on how they understand the rare diseases. Do they really know the importance of standing up for people living with rare diseases. So I mostly use social media as a tool, but also now I sit back and conceptualize on how I'm going to reach out the youth in the rural communities, because it's something that will need more support, more especially financial support, to go and seek them and seek their opinions in the matters that we want to solve in our communities. I think youth hold a potential, and because we are the leaders of today and tomorrow, so us coming up with our own solutions, our own voices, is just stating that we're potential enough as youth. So I would give a message that we shouldn't invest in glamorous leadership, but again, I believe that everything is possible. We shouldn't be afraid to give our time, our energy, because I started as a volunteer. I wasn't paid. I wasn't having the thoughts that I would reach to such spaces, but I started with one step. I want to do it. So I went to the spaces where I would meet my fellow youth. I would meet people that would give me the knowledge and the map to go about my career. And that's where the journey started, without expecting anything. So without expectation, and if you move with the motive of making an impact, you're gonna get further. So avoid investing in glamorous leadership and advocacy, but also move without expecting nothing in return, but rather making an impact to make a powerful and a fruitful effect for all of us. Whatever opportunities we get, we should be really grateful, but also we should not let the spaces only for ourselves, but rather hold hands so that we can all move together. So let's not leave anyone behind.
Really, really beautiful stuff. Carrying forward the theme from our previous episode about leaving no one behind, especially the young people of Africa, the majority, the heartbeat of Africa, the present and the future of Africa. Before we get into what can we do to encourage more young people to be health advocates, I want us to just briefly touch on specific health challenges that young people in Africa face that are unique or mostly prevalent among young people.
Yes, I'm very passionate about young people. I'm surrounded by them. I work at the University of Nairobi. I'm a lecturer, so I have students from age 19 to all the way to 30, 40. So they're really young, productive members of our communities. And for me, it takes such a great pleasure to be with them, to spur them. They also spur me quite a lot. They have dreams, they have visions. And for me, their future, I just dream for them being better doctors, better medics, better people in the communities, making such a big change, innovating. So I'm really excited in these topics of youth and what potential they have. And of course, they face many challenges. And one of the many challenges, perhaps would say, from my perspective, is I could actually group them into 3 or 4 challenges in education, challenges in accessing good healthcare or equitable healthcare, challenges in also getting jobs. We have a lot of people, youth who have a lot of energy, but this energy is not being used appropriately. We want them engaged. Yes, channel it for them to be good economic contributors to our country. And the other one, of course, we want a youth that is healthy enough, both physically, mentally, socially, and in all aspects of their lives. We still have a lot to do for the youth, but I've just touched the iceberg.
Absolutely.
The tip of the iceberg.
What you're just talking about, Dr. Mary, and you're reminding me of the phenomena that currently Africa is experiencing, which is the demographic dividend. I think we see a lot of UN agencies, a lot of stakeholders talking about it is time to harness the demographic dividend. And that is derived from the fact that a majority of Africa's population is made up of young people,
Yes.
and if we invest in their health, education, creating opportunities, they're actually at that productive age and can actually contribute immensely to accelerating the growth of African countries. But that is only if we invest in their health, their education, and general well-being, right?
Okay.
So Dr. Mary Ann was talking about how young people have so much energy, they're vibrant, and I want you you maybe to touch on some of the initiatives that could be undertaken to ensure that all this energy is channeled into productive use, into contributing to nation building and development?
Okay, I'm a pastor, and there is a scripture, there is a Bible verse that instructs adults, parents, leaders, where the youth and children are concerned. So teach the child the way he should go. And when they grow, they will not, that's right. I do believe that this block of potential for our future, the thing that they lack or we could put in place is mentorship. Mentorship will go beyond formal education. It's having people that would take them, interest in them, come into working relationship with them and guide them with wisdom, with care, with restraints, so that their energies are focused. So I think of all the challenges that the youth have, which and a lot of them Dr. Marianne has enumerated, is this because through that we build leadership into them. So neglect of the youth is actually a dangerous
serious concern.
Yes,
I think that's very interesting. I think one of the things that usually comes up when we're talking about youth volunteerism, youth national services, is that these are really initiatives that had a very good intention around character building, teaching professionalism, etiquette, empathy, as we're talking about. And then what has become a bit problematic about some of these initiatives is that they've become a bit exploitative, they've become a bit tokenistic, as opposed to being about meaningfully engaging and empowering young people. So maybe this is why we're seeing a bit of resistance or lack of willingness for young people to participate in these initiatives. So maybe we could just speak to how do we strike a balance to ensure that the engagement of young people, the empowerment, the intention is focused. It doesn't become exploitative or tokenistic.
For me, again, is to have everyone on the table. Sometimes we'll be making all these decisions, these discussions, we've planned all these big, beautiful programs for youth, but there's no youth on that table.
Absolutely.
We are not hearing their opinion. Probably what they're telling us is, and a good example, we were designing this really good program, in my opinion, for youth at the University of Nairobi. And we thought this is going to be life-changing. We're going to touch their mental health. We're going to talk about this and then impact this skill. And then now I sat down with the student leaders. They're like, first of all, anything coming from a teacher or a lecturer in terms of their own personal lives, their mentorship and all, they are always very suspicious. What are they trying to find out from us? What is the end game here?
Too good to be true.
Yeah, and it made me realize, actually, before we go to the youth with our ideas, it's very important to sell these ideas first to their student leaders and hear them out. And for me, it was quite an eye-opener because they were saying the students hear more from them. They trust them better.
That's true.
And in case we have a program, we have an initiative, it's better when it's coming from their student leadership because they're elected by the youth themselves. And that really made us re-strategize and engage them better, involve them. Hey, we have this program or this initiative. What do you think about it? And the ideas we get are really awesome. So again, we need to have the youth on the table. We need to listen to them. What are their challenges? Because we are thinking, my challenges are when I was the youth, when I was their age, is not the challenges they are facing right now. There's technology, there's so many other things that.
And they're not a homogeneous group as well,
So for me, how to address that question, have them on the table. Listen out, empower students or youth leadership. I know now we have even a youth parliament where they cascade some of their bigger issues, maybe to the national government. What are the problems our youth are facing? So listen, hear them out, and maybe then have infrastructure that will strengthen their voice being heard, and then implementing what is the actual need they need. So
Absolutely.
yeah, let's
bring them to the table. Nothing for youth without youth. I think that is absolutely fantastic.
Yes, what I'll add to Dr. Miriam's submission or contribution is that sometimes we think that they are blockheads. Some of them have great ideas, great suggestions. So like she says, if we bring them on the table and listen to them, you see potential. And that becomes encouraging to them to go forward with whichever ideas, innovations that they have and be released, because they know that the adults, the seniors, support them. They are valid.
And our mothers and children, in matters of health, a few improvements such as making sure that the mothers take note on healthy and nutritious feeding for kids, adhering to all the advices and the checkups that they should regularly take, and not ignoring the fact that a small illness, even a cough, is a huge illness to a child. So they should take great caution on such cases, not trying to treat everything at home.
It starts with spreading the awareness. We are, as a community, I don't think we are fully aware of the dangers or the pros and cons of healthy living.
I had to spend all my savings and not really earning, and that really got me into some moment in my brain where you're spending and not earning, and it really gets you down. Like, you have a family to take care of, maybe other things to run that needs money, but you're spending everything and not getting back.
I think this is one of the critical components where we're talking about majority of the population not being represented in leadership positions. What can we do to sort of cultivate an environment where we can see more young people taking up leadership position as activists, as advocates, but also critically as decision makers? Because ultimately you need to be around that table where decisions are made.
Yes, so I would start off with civil education. And this goes back to my general theme in life, creating awareness. And we noticed in the last election in my country, the youth did not vote. And that was really shocking. But then when we went and looked back, did they get educated, civil education on why is it important to be a leader? What decisions is this leader going to make? And if they know the decisions, the importance of that leadership, the importance of representation, then being the majority numbers would see more vying for many of these electable seats and many coming out to vote. So civil education, who do we need to do that? We need both the government, we need both NGOs, we need every sector of the society being actively involved in leadership, actively involved in training the next generation of leaders, showing the importance of how a bad decision can be made and for them being left out and having the national cake being shared by the older population. We respect them, yes, but we need our youth actually being actively involved in many of this decision making. And for me, I think would start with civil education. And then with building on top of that, we need to have accessible facilities for them. If in terms of, I'm thinking of innovations, as Reverend has said, many of these youth are very bright, have very good ideas, but they have nowhere to channel these ideas to. So our youth need to be mentored. They need to be grounded in a way. And for me, if we are going to do that, let's have more partners joining in this conversation. We need industrial partners on this table. We need, of course, the government and non-government organizations. We need community peer leaders, the gatekeepers, where we can create these incubation hubs or these innovation hubs where we can hone in on that idea they have. And we never know, in our African youth, we may have the next Steve Jobs or the next Mark Zuckerberg with a very innovative tool. And we've seen from season 1, season 2, our youth actually winning some awards.
They are.
We saw the other day the visual AIDS award given to one of the youth that presented or used the COVID-19 challenges to come up with really creative innovations.
Absolutely.
And again, we just need to have those hubs, innovation hubs, incubate these ideas, mentor them. And again, we're going to see a very thriving population, both in leadership roles, both in industrial roles, both in the medical sector, and all-rounded youth. And as you mentioned, having a productive youth population will span the economy of a country.
Absolutely.
And that way we'll stop talking about poverty and lack of basic items, because our youth have become very productive.
Of course. And the young people are actually ready. You know, they are vibrant, agile, enthusiastic. In most cases, it's really the lack of opportunities for them to actually thrive, to actually explore their potential, to actually contribute actively contribute to nation building and development. So I think I totally agree with you on political education, creating structures, and even those hubs, because there are a lot of those hubs in our countries, right? We have the youth hubs, IT hubs, but then you still find that young people are still engaged in a very tokenistic manner, picture opportunity. We have a minister coming, let's have young people. But we're talking about young people being in leadership, being at the helm of deciding how that hub is going to run, what programs are going to be there, the incubators and all of that. So I think that component of meaningfully engaging young people is still lacking. And maybe as we wrap up, Reverend, I know you want to contribute to what Dr. Marianne was saying, but I also wanted sort of to end on a high note, maybe share some examples where there's been successful, meaningful youth engagement, meaningful leadership of young people, and it actually was exemplary.
Yes, what you said is right. But what I want to drop in is the fact that leadership and good leadership doesn't happen at an instant. It's progressive. So I would say that we need to give our youth the opportunity to serve in every community where they have the chance to use to learn, try out. They may fail once or twice, but they will learn or outgrow out of that. And from one level, they go to the other until such time that they are now capable to take bold decisions and make valid contributions to the building of community. Yes, absolutely. I think for most people, that is the pathway. I just suddenly didn't become a leader. I have served in various platforms, and I've been monitored, my faithfulness, my timeliness, how I carry myself. And you have an adult tell me, no, you don't do it this way. You do it that way. You should have done this before. Without it, you can't just produce leaders that we're talking about.
No, I think that's true. I think the idea is having intergenerational exchange of ideas, intergenerational leadership. There's an African proverb that says, what young men cannot see standing and older men can see sitting. So I think the idea is not to say we phase out adults or we only have young people in leadership, but just to say that if we have this huge cohort, which is the majority of Africa, the future of Africa, they definitely should not be on the periphery of decision making. I think. But before we end the show, let me just take your final parting shots, and I want it to be messages to young people. What can they do where they are in the spheres of influence to actually be involved in health programming, become advocates and activists for healthcare? Let me start with Dr. Marianne.
Yes, so I'd want the youth to think outside the box. But before they start thinking out of the box, I want the youth to first look at themselves. We are putting quite a lot of pressure on our youth. You have to pass your exams. You have to get a job when you finish university. But with all that pressure, How is their well-being? How is their mental health state? Because again, we're looking at having very successful youth. We also have to look at that their whole general well-being is well spanned out. And with that now, we then need to, again, as I keep saying, have them on the table. We have a lot of challenges. One of the main challenges, again, you can see are health related. For me, from my field is sexual and reproductive health. Our youth are facing quite a lot of challenges in terms of where do they go when they need advice? Where do they go if they want to access, pregnancy or preventative strategies so that they can also be thriving in all they're doing? Do our young girls know about HPV vaccine that to protect them against cancer? So we need the youth getting well educated, well versed in these challenges, and then use them to be the advocates, to be the community health leaders or champions out there, talking to the young girls in high schools. Go and talk about, you don't need to have a boyfriend right now. Oh, boyfriends, I mean, by the time you're 20, 30, there's so many other priorities. And I think the message resonates so well when it comes from a youth to a youth. They're not from a mother like me and I'll go there like, dare you. So we need to first have them on the table, look after them, their well-being, and then use them, empower them to be the voices out there. Because this is our next generation of leaders, our next generation of innovators, our next generation of healthcare solutions and providers in our society.
Absolutely. Thank you. Very briefly, Reverend, talk to the young people about taking up their role as change agents and advocates for health.
Yes, one of the things that I've come to know is that success is not defined in your own personal achievements. But success is how your life impacts other people, whether in a word or a deed. And as a youth, you have all the time and the energy in the world to do good things for people. I want my youth today to take the advantages that are, the opportunities that are available, to volunteer, to disseminate information. The youth are more on social media and all these media platforms than any other age bracket. And what an opportunity for you to channel this energy to propel news about health. We're talking about universal health coverage, and it is an area that you can support greatly. If you have to choose to do your national service, why not go with the idea that I'm not just going just to, but also to help the people where health is concerned, and you'll be doing a great job.
Thank you very much. I think the idea is that if you're a young person in Africa today, you look around you and you're not happy with what you see. The big question is, what are you doing about it? Because there's always something you can do, no matter how trivial that effort may seem. Change always starts with us. We're going to wrap up the show, but before we end, I would like us to take a look at our African health champion for this episode, and that's going to be Trace East Africa, Kenya. Let's have a look.
Meet Trace East Africa, a beacon of change dedicated to uplifting communities and championing health across the region. With an unwavering commitment to progress, Trace East Africa employs a multifaceted approach to catalyze transformation. Through dynamic roadshows and captivating activations, they empower community champions and amplify health awareness. But Trace East Africa's mission doesn't stop there. By strategically sharing information in bustling campuses, markets, and key spots, they are crafting a healthier, more informed East Africa.
And that brings us to the end of today's episode. I do hope that you did learn something, and remember to continue sharing the knowledge that you have acquired from today's show. From my awesome Africa Health Check team and I, we give you a big thank you for tuning in. Remember to subscribe, like, share, and leave a comment on all our digital platforms so that you may form part of the stories that we highlight here. Follow us on Facebook, Twitter, YouTube, LinkedIn, and Instagram. The handle is @AfricaHealthCheck. Until we meet again, same time, same place, same date, remember, the future is Africa, the future is today.